The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement, on News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
You're back up to it, and hopefully you're not using your snow brush anymore. That was just crazy. I remember Wednesday coming out and thinking that I don't have to clear off the car or anything, and there was like 6 inches of snow on my car.
Well, that's because you and I live north.
Yeah,
South,
right.
Yeah,
South, they didn't get anything,
they didn't get much, but yeah, and then a couple days before that, all that ice. Did you have all that ice on the...
that was crazy.
I'm done.
Yeah,
I've had enough of it. Enough with it all.
Yeah, with the snow. It's just too much.
No, it's not as bad as talking to a doctor. Oh, look who's here.
We've been talking with Dr. Mark Pietropaoli. He's the owner of Victory in Motion, the home of knee repair, not knee replacement. And he wrote a book. It's in your category of orthopedics. I think it's like number one on the bestseller of the...
We become a number one bestseller on Amazon, yes.
On Amazon KDP, yeah, there you go. Steve is showing it. If you're on the YouTube, you can see that.
Yeah, repair, not replace.
Yeah, so look that up. There's an interesting infograph in there he was showing me. So you could pull that back up and show it to the camera that's right in front of you. So it turns out that what does that indicate? Why don't you tell everybody?
Right, so... What this graph shows is, so how do we know if our results are good or not? We keep them in a national data bank registry called Data Biologics. What does that mean? That means that we track how our patients are doing. So when you come to see a doctor, you come to see us, you want to be able to do more things, right? That's called function. Mm-hmm. You want to increase your function. You want to be able to fish. You want to be able to weightlift. You want to be able to play with the grandkids. You want to be able to travel, walk the dog. That's function. And then what other reason do you come in? Why else would you come in to see me?
Well, you're a nice guy.
Have
lunch?
Coffee. I don't know. The snacks are great.
I choked. All right. I set myself up. Why else would you? Exactly. Pain. Exactly. Yeah. So you're in pain, and you want your pain to go down, and you can't do the things you want to do, and you want your function to go up.
Sure.
So we can compare ourselves to other clinics that are in this registry. So there's about 200 regenerative medicine clinics in this national registry in the U.S., and we can compare ourselves to them by looking on the website. I was just on it today. But in the book, it goes through 0 to 12 months. But now it's out to 24 months, and we're still outperforming everybody else. But you can see this lower graph right here, this lower line is, your function's going to go up if you go to any other regenerative medicine clinic. But because we do programs, we don't just do a shot and then say, see you later. Your function is going to go way up, and it's going to stay up much higher than it would if you go to some other clinic. And I'm not bragging, these are just the results.
Yeah.
And then pain, you want your pain to go down, right? So you go to someplace else, they give you a shot maybe and say, see you later.
It's better for a little bit, maybe.
Well, it gets better, and it kind of still goes down over the course of the year. But look at us, it goes down quite a bit, and it stays down. Yeah. And these are 12-month results. I just looked on the website, 24-month results out, and we're still significantly outperforming the other, 100.
Page 19 of the book, if you get that.
199 clinics out there.
Very good.
So you got to track your results, is what I'm trying to say.
Right.
If you're going to go to some doctor, and they're going to tell you all these things, ask them, what are your results? How you guys, how successful are you? And we can show them those things.
If people don't go to you for a second opinion, and they go to another orthopedic surgeon or specialist, they're probably going to hear more or less the same thing, because aren't people like trained a certain way? Okay, it's bone on bone. Okay, it hurts when you do that. We'll put a shot of cortisone, whatever the heck they do. It's kind of the same, right? Where maybe you're just totally not the same.
No, the traditional treatment is that. That's what we were taught. Give it a cortisone shot, which we know damages cartilage, and people who get cortisone are more likely to go on and need a knee replacement.
Do people know that?
No, but if they read the book, they should.
Okay.
But people are always surprised by that. That cortisone. That most people know cortisone's not good for them, but they don't realize it's actually really bad for him because
I don't think the doctors are telling people that.
No, because the doctors are also hamstrung. It's not necessarily their fault. The insurance companies, they'll pay for cortisone, but they won't pay for you to use your own blood, for instance, which has growth factors, or your own cells in your bone marrow, which has stem cells and other cells that help the stem cells. They won't let that be paid for, but they'll pay for cortisone or things that are not very effective. And then if that doesn't work, then you're right. Then we're programmed during our training to say, as surgeons, okay, well, you didn't get better with these things, then you need surgery. But you don't always do.
I saw a video the other day that you posted of one of your people, and they were like, it was like Jack LaLanne after. They were like, look, what I can do this, and I can do this, and tell the story. I was like, and now I can do this, and look at me, I can touch my toes, I can touch your toes.
Yeah. All right, Diane is in the book. Diane's in the book. I don't know exactly where she's at, but the point is,
what was her situation?
She's 83 now, so 4 years ago. So
okay, she didn't look 83.
79,
okay.
Yeah, and she was told she had left knee osteoarthritis. She couldn't walk her dog, and most importantly, she couldn't do her yoga poses. She loves yoga, and it's a social thing too. She goes with her friends.
Right.
So she came in, and we said, "Yeah, no, I think we can help you with one of our knee repair, not knee replacement programs." We used her own blood. We used her own bone marrow cells, which has stem cells. We used laser treatments on her, but most importantly, we did total body strength and conditioning with her. And so she got back to basically 100% with her knee, and now she's like 4 years out. She's in the book. I gave her a signed copy, and we did a post on that. But she was putting herself into all kinds of contortions I couldn't do.
Really? Tom, she runs circles around us. I was like, are you kidding me?
Yeah, I couldn't believe it. So but she still does everything we taught her. She still goes to the gym. She still goes to yoga. She does everything she's supposed to do, and she's 84, and she looks like she's I don't know, 70.
Yeah, right.
She's amazing.
Great.
But it just goes to show you, we don't want to just give you a shot and say, see you later, and abandon you. We want to teach you what you need to do, and we don't want you to have to come in every 6 weeks for a cortisone shot. We want you to get better and stay better on your own.
So Day of Clarity, you came in, you got the studio here a little bit early. You were talking with Lori, who runs everything here. Everybody knows that, who is in some pain, and you guys were talking about the Day of Clarity. Explain what that is.
Well, we got about 2 minutes. So the Clarity Day is basically what Lori's going through right now. Is if you don't, she said she's okay.
Fine. So she goes, I don't know. I'm looking. She goes, tell him. She didn't care. She was because I asked her permission.
She's having some really bad neck pain, numbness and tingling shooting into her hand, and she went to her regular doctor, and they said, well, just go to physical therapy. So she hasn't had X-rays, MRI. You don't really know what's going on for sure. And she's in a ton of pain, it's not her therapist's fault. They think it's a pinched nerve as well. They've done their best for the first 3 treatments. But wouldn't we want to know exactly what's wrong with her? Don't we want to really know if she has a herniated disc pinching a nerve? And then not only that, I spent a bunch of time with her just talking to her out there. Turns out she's had a shoulder problem for a long time. So maybe her shoulder's causing her to overcompensate with her neck, and she's having neck issues, or vice versa. So the point is, we'll spend an hour with you, not 7 minutes. We'll figure out what's wrong. We'll get a set of X-rays. We'll get an MRI. We'll do an ultrasound if we have to. We'll have your whole body evaluated by our total body fitness people.
All on premises.
Everything, all on premises, all on the same day. So when you leave, we are going to figure out what's wrong with you. If we can't figure out what's wrong with you, we will give you your investment back. If we can figure out what's wrong with you, we can take care of you. We'll give you a few choices on what we think would be best for you. If we can figure out what's wrong with you and we can't help you, like if she needs surgery for her neck, I don't do that, but I'll get her in to see somebody. We won't abandon her. So we can get that all figured out in one day.
So, Mark, your excitement, your passion to help people sits underneath this. You get excited when you know you can take someone out of pain.
Help someone. It's very exciting.
But that second opinion, maybe it's a first opinion. How can I get out of pain? Certainly victoryinmotion.com. It's all there. Or write the number down, 685-7544. We're up the road here in town, 685-7544. Have the courage to make the call, ask the questions, victoryinmotion.com. Thanks for joining us today, Dr. Mark.
Thank you, guys. I appreciate it.